Hello and welcome to this Chanelle CPD session. My name is Jonathan Moore. I'm a veterinary surgeon and the Veterinary Technical Services Manager for Chanelle Pharma. Today I shall be talking about parasite control in the summer and autumn for both cattle and sheep production systems. This presentation is accredited by both AMTRA and VetPol. For information on claiming CPD points, please contact your Chanelle representative. This presentation will cover the optimal parasite control approach and the benefit that this brings, specifics of the seasons in terms of parasites encountered and the impact of weather conditions, considerations to minimize resistance development, and finally we'll cover key parasites of the summer and autumn for both sheep and cattle with a discussion of possible treatment options. Let's think about the time of year, the summer and the autumn. As we can see on this slide, the primary concerns for producers during the summer and autumn are gutworms and lungworms. However, we can also see some crossover with coccidiosis and fluke infections from the spring and autumn respectively. This can be compounded by adverse weather conditions. Climate change is altering our traditional weather patterns. We are now seeing parasite problems occurring outside of their expected seasonal periods. And this is something that we will have to be increasingly considerate of in the future. Experts now suggest that in many cases, especially for nematode infections, we need to move on from blanket treatments, preventative measures, and even active rotation programs. They recommend the following as the optimal approach to parasite control. Monitoring the condition of stock, production parameters, and weight gain. This specifically considers the impact of subclinical disease. As well as subclinical disease, where we don't see clinical signs, we have to consider clinical disease where we do see clinical signs. For example, we may see coughing in lungworm infections or scouring in parasitic gastroenteritis. So correctly linking clinical signs with the parasite present. It's important to have a good knowledge of both the farm and stock history. What disease problems have been seen on the farm in the past? How have these been managed? How successful have these management programs been? And also, where has stock been grazed on the farm previously? Adequate quarantine measures for new stock is critically important. New stock represent a real risk of bringing new disease onto a farm. And there are a number of quarantine strategies which are discussed by organisations such as SQPs, COWS, NARDIS, or the Agriculture and Food Development Authority in Ireland. Appropriate testing should always be carried out before antiparasitics are administered. This is so we can correctly identify the parasitic problem present and identify the level of the problem. Tests include fecal worm egg counts, bulk milk ELISA tests, blood tests, etc. Once a test has been carried out and the appropriate treatment administered, retesting after treatment is crucially important to monitor treatment success and to identify potential resistance issues. Possibly use older classes of antiparasitics before newer classes for specific infections where you know there is sensitivity to these actives. For example, nematodirus in lambs is still sensitive to whitewormers, so it's sensible to use these products before some of the newer products such as macrocyclic lactones, for example. So there are 4 basic principles of parasite control to remember. The first of these is test before treatment, identify the problem and the level of problem, treat with an appropriate active based on those test results, and after treatment, retest to check for the success of treatment and to identify any potential resistance issues. Based on the retesting, adjust treatment if required. Resistance is considered to be present in a population of parasites when antiparasitic treatment results in a less than 95% decrease in parasite numbers. Successful treatment removes more than 95% of parasites from the animal, and this is determined by these testing methods, such as fecal worm egg count. So what are the parasitic risks associated with summer and autumn grazing? Well, at this time of the year, the weather is often warm, but it can also be wet. And wet and warm weather can favour parasitic survival and reproduction, increasing disease challenge to stock. Egg contamination from the previous year can also raise the burden. We need to keep a close eye on the weather and adjust our tactics accordingly. We also need to keep careful records of stock grazing and production parameters to track the risk potential for different areas of the farm. So what are the benefits of appropriate parasite control, that optimal control strategy which we discussed previously? This is a big one. This is the why. Why do we need to do all of this? What are the benefits? It's crucial to be mindful of this, especially when considering return on investment. Managing and treating animals for parasitic infections costs time and money, so we need to be clear on the rationale for undertaking control strategies and be choosing the most favourable approaches to maximise that return on investment. So the benefits include reducing the clinical disease seen on the farm. We also improve the health and welfare of the animals, and importantly, this can improve the PR, the public relations, and the public perception of farming. As we all know, farming is under threat from a number of different sources at present, so everything we can do to improve the PR of farming is important. Another benefit is we will optimize growth rates and improve feed conversion ratios, and this is by addressing that subclinical disease. So remember, parasitic infections are often invisible. They go under the radar when they're not quite at the level where clinical disease is seen. And if we can deal with this subclinical problem, we will improve the production parameters of the animals. Another benefit is we reduce pasture contamination. So we reduce the disease pressure for this year's population of animals, but also this can be a benefit to animals in subsequent years. Naturally, if we do all of this right and we apply these optimal approaches, we will increase farm profits. And finally, and importantly, if we do things right, we reduce the selection pressure, which is driving the development of parasitic resistance. Resistance is becoming an increasing problem for many of the actives we're familiar with. When an active is first brought to market, resistance in the parasite population is low and the products work very well. Unfortunately, this effectiveness can be hampered by indiscriminate and/or inappropriate use, which creates selection pressures in the parasite population. Before too long, we start to see the effectiveness of the products start to decrease. There are a number of research papers which have looked into this problem, and here are the results from a couple of studies in Ireland, the first of which looked at sheep farms. So in this study from 2023, 18 sheep farms were examined across Ireland, and there was testing undertaken to assess the level of resistance to commonly used wormer groups. In this study, 100% of parasites examined were resistant to the white class of wormers, the benzimidazoles. The yellow class, levamisole, 17% of the parasitic population was resistant, and for the clear wormers, 16%. The 16 and 70% are obviously considerably lower than the 100% for benzimidazole wormers. However, these percentages are concerning and on the increase. A similar study looked at this issue for cattle farms, again in Ireland. And again, the results are concerning. This study looked at 16 cattle farms and examined resistance for the different classes of wormer in the Couperia and Ostatagia populations on this farm. For the benzimidazole group, there was a 60% prevalence of resistance across the farms. For levamisole, much lower, 18%. Ivermectin, 100%. So ivermectin is one of the older classes of macrocyclic lactones, but concerningly, the resistance prevalence for moxidectin was 73% across these 16 farms. We need to maintain the efficacy of molecules available to use, and to this end, experts recommend the following approach. This advice comes from cows, but is repeated by bodies such as the Irish Agriculture and Food Development Authority, NARDIS and SCOPs. And this is the right approach, or the 5 R's. So the right product for the right type of worm, the right animal, the right time, the right dose rate, and products given in the right way. And these 5 R's are really important to remember and to consider. So as well as everything we've discussed with the antiparasitics, there are some other things that are important to consider as well, and this can help to deal with the problem and reduce the disease pressure. So pasture rotation and management and good husbandry practices are also crucial. Good pasture records of stock usage and disease that's been seen on the farm and the successful failure of any treatments can be very important information. A reduction in standing water, mud and ground poaching can reduce infection pressures. This is important for many of the nematode species, but it's also really important for liver fluke too, and we'll discuss that in a little more detail further in the presentation. Good hygiene and good biosecurity is always an important part of farming, and this goes for the parasite control as well. Good biosecurity practices can help to reduce the spread of infections between groups of animals on the farm, and also help prevent infections coming in from outside of the farm. Finally, it's always important not to exceed recommended stocking densities. If stocking densities go above the recommended limits, then we're more likely to see increase in disease pressures and parasite pressures, increased burdens on animals. Producers should always bear the following final points in mind. Take note of the duration of action of the active that you've chosen. Some actives will have no residual activity, whereas others will have long durations of activity. And this will change your approach to parasite control on the farm. Always be mindful of meat and milk withdrawal times. This is especially important for dairy animals, where many of the actives that we're going to talk about are not permitted for use in animals producing milk for human consumption. Always consider the environment as well and what the environmental impacts of using these actives may be. Try and avoid things like product spillage or leaking into the environment, and always dispose of packaging and unused product as per local guidelines. Please don't just pour unused products down the drain. Finally, always read the data sheet and products information leaflet, and contact your vet or SQP Rama if you have any questions or concerns. Let's now go on to look at some of the key parasites that can cause issues in the summer and autumn. And let's begin with sheep. First on the list of key parasites for sheep in the summer and autumn is Teledorsagia circumcincta, and this is known as the brown stomach worm. These nematodes cause damage to the abomasum as they emerge from the stomach wall as part of their life cycle. This results in profound scour, ill thrift, and possibly death, especially in mid to late summer as pasture levels rise. This essentially is the sheep version of ostatagia in cattle, which we shall be discussing shortly. Unlike ostatagia, it has two types, type 1 and type 2 subtypes of the disease, and these are characterized by the time of year they occur. Type 1 is seen in the summer and autumn. This is the one that we're really focusing on now. But type 2 occurs in spring after worms emerge from the hibernation in the abomasal wall. This hibernation is referred to as hyperbiosis. Natural immunity is usually achieved to this parasite in around 3 to 4 months. However, type 1 disease can be a factor in the summer and autumn as pasture levels rise. This parasite has a 16 to 21 day pre-patent period. It's also worth mentioning that type 2 version occurs in the spring is called the spring rise, and it results from periparturient relaxation in immunity, or PPRI, in ewes. The extra demand on the ewe's bodies before lambing can lead to a weakening of natural immunity and subsequent rise in egg output. If ewes are otherwise healthy, it doesn't impact them, but this effect poses a risk for the new lambs. Good nutrition can minimize this egg output. And this problem is usually seen in the last 2 weeks of pregnancy, up to 8 weeks post-lambing. Although licensed to treat telodosargia, white wormers are commonly now ineffective, and this includes albendazole, our Albex product, fenbendazole, Zerafen, and oxfendazole, Bovex. It's worth noting that in sheep, white wormers are often used for nematodirus treatment in spring lambs, as this parasite has yet to develop resistance to this active. The macrocyclic lactones such as moxidectin and ivermectin are often chosen to manage telodosargia, and levamisole can also be used. However, resistance to these actives has been reported and is increasing in frequency, especially for ivermectins. Next, we have Trichostrongylus species, or the black scoureworm. These parasites tend to cause problems in the autumn and early winter when 8 to 10-month-old lambs present with dark-coloured, foul-smelling diarrhea. This nematode does not tend to be as damaging as others and rarely causes death, but ill thrift is often present. Like telodosargia, this parasite can encyst or hyperbiose in the gut wall and over the winter months. From the Chanelle range, these are the products which are licensed to treat Trichostrongylus species. Like telodosargia, white wormers are commonly now ineffective, and this includes albendazole, Albex, fenbendazole, Zerafen, and oxfendazole, Bovex. Like telodosargia, the macrocyclic lactones such as moxidectin, Moxidex, and ivermectin, Animec, are often chosen to manage this parasite. However, resistance to these actives has been reported and is increasing in frequency, especially for ivermectin. Levamisole is less commonly used. As acute and subacute fasciolosis are often seen at the same time as the black scoureworm, Tribomet duo may also be used if the parasite types are both present. Tribomet duo contains ivermectin and triclobendazole. Triclobendazole is the optimal choice for the immature life stages of fluke, which are responsible for the acute and subacute versions of fasciolosis. We shall be looking at this shortly. The next nematode that we're going to consider is a little different to the others, and this is the Barber's poleworm, Homunculus contortus. The Barber's poleworm is a blood-sucking worm that can cause anemia, production losses, including ill thrift and reduced milk yield in ewes, and often death. The red stripes around the worm, which give it its name, is actually blood that is consumed from the host animal. It's visible to the naked eye and lives in the abomasum. As little as 5,000 worms can lead to 250 mils of blood loss a day from the animal. In acute infections, we see sudden death in otherwise healthy sheep with no scour being present. Subacute disease is seen when animals have ill thrift, but also potentially submandibular edema from changed fluid balance within the animal. This is often called bottle jaw. Chronic disease is less likely to be seen due to the severity of this parasitic infection, but if it is seen, we do see a failure to thrive. This parasite has a short 14 to 15 day pre-patent period and just a 20-day life cycle. Egg output is high, meaning that groups of animals can rapidly become infected, although often clinical disease is seen before the parasites have even completed their life cycle. So actually fecal worm egg counts can be less useful for this parasite. This worm can overwinter in animals, but disease can be seen at any time if weather conditions are suitable. Adult sheep don't develop immunity due to the sporadic nature of outbreaks and the sudden challenges with high mortality rate. This parasite is generally rare, but it's becoming more common, and warmer weather has led to spread to all parts now of the UK and Ireland. In terms of the products in the Chanelle range, which are licensed to treat Homunculus contortus, we have the following. It's worth noting that whiteworm is commonly now ineffective, including albendazole, Albex, fenbendazole, Zerafen, and oxfendazole, Bovex. Macrocyclic lactones, such as Moxidex and Animec, are often the actives of choice. However, in a similar fashion to other nematode species, reports of resistance are becoming more widespread. Finally, for sheep, we have the trematode parasite Fasciola hepatica, or liver fluke, and this causes the disease fasciolosis. This parasite has an intermediate host as part of its life cycle, and this host is the mud snail. Mud snails thrive in warm and wet environments, and therefore there is often an issue on lower lying wet farms and after periods of heavy rainfall, and these can result in very high infection pressures on farms. And this is why, linking back to what we talked about previously, it's important to try and reduce standing water and poaching where possible. This parasite has a long 20-week life cycle, and as we shall see, disease can be caused by the immature stages as well as the adult stages of the parasite. In the late summer, autumn and early winter, we tend to see acute and subacute versions of the disease, which cause ill thrift, anemia, fluid imbalances, and often sudden death. Acute and subacute disease results from the presence of immature stages of the fluke being present within the liver of the animals, and we can actually see this in this picture here on the slide. This is a post-mortem sample where the liver has been opened and we can see the fluke in situ. Triclopendazole is the treatment of choice for acute and subacute disease because it is licensed to treat these immature stages of the parasite where other fluke products are only effective against adult fluke. That being said, reports of resistance are increasing. A good knowledge of farm history and the outcomes of previous treatment is crucial. So triclopendazole is the treatment of choice for acute and subacute fasciolosis, and this is Chanelle's Tribex product. However, we also have Tribomet Duo, as we mentioned previously, a combination of triclopendazole and ivermectin, which may be best given late summer, early winter alongside infections with Trichostrongylis or other nematode infections. So when we have both fluke and these nematode infections, Tribomet Duo is a great choice. Let's move on to consider the seasonally important parasites in cattle. It's worth noting before we go any further that there are slightly different production systems for dairy animals in the UK and Ireland. In the UK, production is often non-seasonal calving, i.e. we can have seasonal calf disease at any time of the year, for example, coccidiosis. So it's always worth bearing this in mind. In Ireland, calving tends to be more seasonal, making disease prediction slightly simpler. Let's start by looking at osteotagia, in particular osteotagia type 1 infection. And this occurs in late summer and autumn and leads to weight loss, diarrhea in calves, and occasionally death. The worm causes damage and clinical signs when they erupt out the abomasal glands as part of their life cycle. As we said before, the worst case scenario is death. However, reduced growth rates and scouring are more commonly seen. Adult animals usually have developed natural immunity to this parasite by around 18 months of age, but this immunity is described as non-sterile, i.e. infections can still occur, especially if disease pressures are high. In adult animals, abomasal damage leads to reduced appetite, reduced acid production, and therefore decreased feed intake. And this is particularly important in the dairy industry where milk yields can be significantly impacted. The cow's immune systems are working hard, and yet the feed input is reduced. Scour can also be present. Animals can lose up to 20% of their body weight in just 7 to 10 days in worst case scenarios, along with this reduced milk yield. The type 2 version of osteotagia tends to be seen in February to May when the worms emerge from their hibernation and cause similar disease problems. L3 stage of the nematode can also overwinter in soil or pasture and provide infection pressures in the following year if cattle are grazed on the same pasture. Bulk milk tank ELISA tests are useful for identifying the problem in dairy herds. These are the products in the Chanelle range which are licensed to treat osteotagia. Although licensed, levamisole is less effective against this parasite. The benzimidazoles show less resistance compared to the situation in sheep. However, often the 3-ml products are the best choice, especially aprinomectin or Eprimec for milking cows with its 0-day milk withdrawal. Although reports of resistance have arisen in recent years. Next, we have Cuperia oncophora. This nematode is considered to be relatively mild in comparison to osteotagia, but can have significant impact on production and cause parasitic gastroenteritis. The problem is most prevalent in calves as their natural immunity is yet to develop. Animals develop natural immunity after their first grazing season. As a rule of thumb, cattle must be at grass for at least 8 months on pasture that has been used for cattle in the previous year to get enough exposure for immunity to develop. Like osteotagia, L3 life stages of the parasite can also overwinter in the soil or on pasture. These are the products that are licensed to treat Cuperia oncophora from the Chanelle range. Note that there's no Eprimec here, as this particular parasite tends to cause a problem in younger animals that are not yet in milk. There are resistance issues with ivermectin, especially in Ireland, and there are also signs that there can be a cross-resistance with moxidectin. This is the Animec and Moxidex products. Benzimidazoles and levamisole tend to still be effective with lower incidences of resistance being reported. The final nematode we should consider is Dictyocaulus viviparus, or lungworm. This parasite causes coughing and severe respiratory distress, often called hooch or husk, and is often seen in the late summer, early autumn. Calves are particularly at risk when grazed, leading to production losses, weight reduction, and potentially death. The parasite's larvae migrate to the lungs via blood and lymphatic vessels after ingestion, and adults and larvae can actually overwinter in animals, which then act as silent spreaders. The situation with natural immunity is complicated. It develops relatively quickly, but can wane quickly as well, within as little as 3 to 4 months, meaning that reinfection is possible. Low levels of exposure can be useful to maintain this immunity. Care should also be taken in severely affected animals due to the risk of developing concurrent pneumonia, one of the biggest killers in cattle. In heavy infestations, many anthelmintics cause the death of the parasite, which then sit in the airways of the animal and rot, leading to a secondary pneumonia. These cases may need additional treatment, such as anti-inflammatories or antibiotics, and veterinary help will almost certainly be required. Lungworm in adult dairy cows can also be a problem if there is no history of exposure or the herd suddenly encounters high challenge levels. For example, if an infective animal is brought into the herd. The animals in the existing herd, their immunity might have waned, as we mentioned just now. Remember, it wanes in about 3 to 4 months, so they can be at risk relatively quickly. So look out for milk yield drops in the herd, and also listen out for that distinctive husking cough. Heavy rain after a period of dry weather can also represent a risk period, and this can often happen over the summer months. If you think there's a problem, i.e. the milk yield has dropped or you have animals that are coughing, deal with it quickly, otherwise you may see decreased production and worst case scenario, deaths. These are all the products licensed to treat lungworm in the Chanelle range, and the good news here is that all classes tend to still be effective, and the macrocyclic lactones are often the first line choice. So that is our Moxidex product, Animec, and also Eprimec. Eprimec or eprinomectin for dairy cows has no documented resistance. It's worth noting as well that vaccines are often used as well as anthelmintics to manage lungworm, especially for herds or that have had previous lungworm problems. In these cases, animals are vaccinated at turnout and then wormed around July, at least 14 days after their second vaccination. Remember, wormers can actually impact the effectiveness of vaccines. This is something that should always be borne in mind. The final parasite in this presentation is again the liver fluke Fasciola hepatica, this time seen in cattle. Cattle livers tend to calcify to trap the fluke, and as a result, fluke do not usually cause the same level of disease problems as in sheep, unless the burden is particularly high. In general, liver condemnations at slaughter are the biggest issue with this parasite. Once again, the mud snail is the intermediate host, and wetter periods and places tend to cause the greatest disease pressure. Triclobendazole or Tribex can again be used in the autumn or early winter to control immature stages and acute and subacute infections. So we have covered the major parasitic species that cause issues at this time of year for both cattle and sheep. But remember, there are other parasites that can also cause issues at this time as well, but they're less likely. Many of the products that we've mentioned are licensed to treat a range of other parasites beyond those that we've discussed. So, as before, testing, monitoring, treating and retesting all still apply and are very important. Let's summarize a lot of the points that we've talked through into one simple slide. Dose when necessary. And this can be based on changes in performance of the animal, clinical signs, and importantly, the outcome of testing, such as fecal worm egg count testing. Know what works on your farm. What products have been used in the past? Have they been successful? And are there any known resistance issues on the premises? Select the appropriate product for the parasitic problem that you're dealing with based on those test results. Administer product correctly, and this means ensuring that the correct dosage is given to the correct animal. Animals must be weighed correctly and grouped together in groups of similar weight. Dose for the heaviest animal, and also maintain your equipment. Ensure that the equipment has been calibrated properly. Very often when farmers encounter issues on farm, it's because either product has been given inappropriately or the equipment they're using, weigh scales, drenching guns, for example, is not functioning as it should. Grazing management, very, very important. Know what stock has grazed where, know what stock has grazed where historically as well, because that can have implications this year and the years beyond. Follow good biosecurity measures. And finally, remember to retest and adjust treatment accordingly. Here is a list of references that we used to develop this presentation for anyone that would like to dive into these topics in a little more depth. All that's left for me to say is thank you so much for joining me today on this Chanelle CPD session. I very much hope that you found the information useful and informative. If you have any questions or comments, please do not hesitate to reach out to your Chanelle representative, and we look forward to seeing you on another Chanelle CPD session in the near future.